Hello, everyone. We're going to talk about simple tricks to get accurate blood pressure readings at home. Your blood pressure readings at home matters, but only if you do them right. I have seen readings off by 15 to 20 points just because of small technique mistakes. Let's start with positioning because this is where most people unintentionally get it wrong. First, you sit in a chair, just like I'm sitting right now, with your back supported, not on the edge of the bed, not leaning forward. You keep both feet flat on the floor. Do not cross your legs because crossing your legs can raise your reading. You rest your arm on the table so it is at the heart level. If your arm is hanging down, your number can look higher than it really is. The cuff should be placed on bare skin, not over clothing, and it should fit properly. Too loose or too tight changes the accuracy. Before you press start, sit quietly for 5 minutes. No talking, no scrolling, just rest. Blood pressure needs calm to be accurate. Next, timing and consistency. Try to check your blood pressure at the same time every day, usually once in the morning before medications and one in the evening. Blood pressure naturally changes throughout the day, so comparing a random morning reading to a late night one doesn't tell us much. You must have heard in my previous videos that you need to avoid caffeine, smoking, or exercise at least 30 minutes before checking your blood pressure. I'm not saying don't exercise, I'm just saying 30 minutes before checking your blood pressure, avoid those things. If you just had coffee or rushed up the stairs, your number will reflect that, not your baseline. If you've had a stressful moment, wait a few minutes before measuring your blood pressure. Let your body settle down first. We are looking for patterns, not reactions. Finally, record your readings. Don't rely on memory. If you are a patient at P-Cell Clinic, some of our patients already have blood pressure monitoring machine that they actually check their blood pressure at home and we get the readings straight in our office. If you don't have one of those, no worries. When you have your blood pressure monitor at home, just check your numbers and write it down so you can take those numbers to your next doctor's appointment. Write down the date and the time and indicate, of course, the top number is the systolic and the bottom number is the diastolic. Some people also note how they were feeling. Maybe you checked it because you're in a stressful situation. Maybe you're relaxed, tired. You can also record that because context matters. You can use a notebook, a simple spreadsheet, or an app on your phone. Whatever you actually do, just make sure you stick with it. When you bring consistent readings to your provider, it helps us make safer, more accurate decisions. Do you track your blood pressure at home? Save this video to double check your technique and share it with someone who monitors theirs.